Thank you, Councilmember Gonzalez. Councilmember Sandoval.
Thank you, Mayor. And thank you, Councilwoman Gonzalez, for your words. I know it feels like we've been here forever, but I'm finally talking, so I'm going to start with thanking Eric, Maria, and the ELT for a thorough presentation and overview on the situation and how it's affecting the city. And I want to thank also Councilwoman Viagran for her work on the NLC, and I'm really glad that we have you on that national board at this critical time. I don't think it's very lucky of us. And I also want to thank my District 7 neighborhood leaders who have been delivering flyers and informational materials that we've printed up for them to their neighbors who aren't online. So especially Don Rios from Culebra Park, thanks for taking that on. And I also want to thank my colleagues. I am so proud to serve with all of you council members. Each of you have initiative, ideas, you have drive, and Councilman Trevino sent an email earlier today highlighting all of our attributes, and it's almost like you're all superheroes, and this is the Hall of Justice or whatever it is. And so I think we have a great team. So very happy to serve with you, and I think just we're starting to see new abilities and new sides of people as we're doing this. So I think it's really a time to rise to the occasion, and you are all doing it in different and impressive ways. I want to talk for a couple of minutes about the committee, the communications work group that Eric and Jeff Coyle mentioned. Jeff and John, thank you very much for your assistance with that. So I wanted to explain a little bit to the council members and also ask them, if you're not already participating, you're absolutely welcome to send a staff member to one of those. I'd love to have everyone on the team, everyone who wants to be, and I think everyone on the dais has expressed some great ideas that we can move on. Councilman Perry, you were talking about making sure that we get the information out to people who need to hear it in time. And Councilwoman Gonzalez, you said something about, well, maybe not everybody needs all the information because it can be overwhelming and lose its effectiveness. And that's definitely one of the approaches that we want to take, is kind of identifying who are the audiences that we need to reach based on the needs that we're hearing about, and then what's the best way to reach them. We're not going to be able to do it all, obviously, but I think you've given us some great priorities based on what we've heard today. I also want to thank GPA staff for the wealth of information that is on the internet. I know I spoke with Tracy Talavera after our last meeting, and she said that she would look into putting one web page, like a tab just on services and assistance that's available for residents and individuals. That could also help ease some of the anxiety that people might feel. And I think that's also why people want to hear about the recovery, is because they don't see an out right now, especially if you've just lost your job. So that, thank you, but that could help. The other thing I wanted to thank GPA for was having sign language available for every major announcement that we've had. I think that's great to see. We also talked at a couple of these meetings regarding people who aren't connected to the internet, which is a significant portion of our population. But before I go into detail about that, I want to say that we are critically, as an organization, relying on the internet or the web to get information to the public, whether it's you sign up for COSA.gov or you read it on your phone or on your computer. Is that a radio? Or you hear it on on your computer. And I think it's also important to recognize that phone service and internet is also critical infrastructure at this point in time, and I'm glad to see some internet companies stepping up to help students who are trying to do distance learning right now. It's also critical that all of our residents who have access to that right now continue to keep that access during this time. So probably something that we also need to think about how we do that at this time, when what organizations we work for. That's not a municipal utility, obviously, but certainly a utility. And in terms of, I know we've gotten the message out there. You've done a lot of education about how to do social distancing, and this is going to be new for a number of organizations. I mean, I think everyone on this dais probably, well, most everyone on this dais probably knows that even issues of code compliance, right? How many times do you have to go out and tell people and visit them and talk to them for some very basic parts of code compliance, and the long cycle that takes? So we have the same audience, right? But we have a different problem today. So we also have to be creative with some of the ways that we do that. So I think our group and our forum is a great opportunity to do that. And I do want to thank everyone who's, the council members who have participated in that with me, and Councilwoman Andrew Sullivan, Councilman Trevino, and Councilwoman Rocha Garcia, and of course Councilman Pelaez. And they also happen to be the members of the Community Health and Equity Committee, which brings me to another very important point that I think we need to discuss, is that just as we're seeing effects on employment and so many issues as a result of the spread of the virus, we are going to see an impact on health too. All these people who may be losing their jobs right now, if they had health insurance, they may not have it in a few weeks. So we're talking about like a kind of a feedback loop of the virus causing economic impact and giving us further problems in health. And I think we need to think about what that means when we're going to have thousands of additional people that may not have a health place to go to. Clearly a conversation that we need to have with the county. Same with food security and WIC. We probably need to see I'd be curious to know if we've had a decline in the use of our WIC centers with ever since the orders came out. So that's something, if staff could send us, would be appreciated. Jeff, I know you're standing at the ready, and if there is something you want to share, I want to go ahead. No, please go ahead.
I don't want to interrupt, but I thought you'd be interested in both of these things. Tracy followed through and built the resident assistance tab, so it's right on the home page. There's a whole series of things: food, rental, housing, all sorts of things. And this is not to just call out one company because the others might do the same, but the other day AT&T let us know that they were, because of what you said, it's critically important that people still have access. They're offering several months of free service when you signed up. They've expanded their eligibility for their low-income program. It's as low as $5 or $10 a month to be able to have service, and they're waiving any data overages so people can get unlimited. So I would imagine the other companies are doing the same, but the point is they're on the same page with you that we need to make sure people still have access to information during this time. Sorry to interrupt.
No, this is not an interruption at all. That's great to hear. Thank you. Thank you very much. So now I want to circle back with, I have a couple of questions. One of them is for Chief Hood. Thank you for your presentation. Thank you, Chief. You said something very reassuring during your presentation, and that was that we have hospital beds and that we're going to be able to handle a surge in need. Can you tell me about that? What do those numbers look like right now?
Well, we're still trying to identify the numbers of beds, but we know for sure that hospitals operate at about a 90% rate of where they're full. Most of the elective surgeries have been canceled, so there's going to be additional space. So what we're doing with the regional medical plan, as far as looking at all of those hospitals, understanding what they have in them as far as ICU beds, things like that. So if you could picture a balloon, big red balloon, and so if you blow that balloon up, what's the system look like before that balloon pops? And so that's what we're trying to get our hands around with the analytics, working with the hospitals. So we have triggers. We have triggers that will allow us to say, okay, we need to move people in a step down to a hotel, which we've located. We have triggers to where I have a bunch of public safety and healthcare workers that are sick or need to be quarantined. We've got a hotel for that. So we have different levels of plans to work with the hospitals to identify what their capacity levels are, and then we will move into those different directions.
Okay, no, I'm glad to hear about that coordination, but in terms of numbers and how many beds we don't, you're calculating that at this time?
You know what, and again, we're calculating that, and if we would give you bed numbers, we would never say, okay, well, this hospital has this many beds, or this one has this many. We're looking at,
it changes.
I know, but
right?
what we would do is look at beds in our region.
Correct. And in terms of ventilators, what's the game plan?
You know, everybody has concerns about ventilators. If you ask me how many ventilators we have in this region today, I don't know. But if you ask me what hospital had patients on ventilators, I could tell you that. And so we're again trying to manage that information and get that to where we understand it if we have a surge. With some of the resources we're going to be requesting from the state as far as setting up field medical hospitals and those type of things, those would come with ventilators and equipment. So again, we're still trying to get our hands wrapped around ventilators, but if I told you we had 300-400 ventilators in the city today, I couldn't tell you, and I don't know if it really matters at this time, because we're still trying to get the information for the surge, and hopefully the people that need ventilators, we're going to be able to keep them in the hospitals and move the other people out into other facilities.
You know, when we first had the Lackland evacuees here, and one of them was taken to the hospital, they were taken to a negative pressure room. Is that still going to be a requirement for anyone with the virus who has to be hospitalized?
I'm probably not the person to answer that question. Maybe Dr. Bridger could answer that.
No, they've changed the requirements. That's no longer a requirement.
Okay, great. Well, thank you, Chief, for addressing that. I know you said it's not important at this time, but we get a lot of questions. We read a lot of things on the media. And for me, it would be very reassuring to get a tighter understanding of that.
When it's not important, it's critical. But for me to stand up here right now and say, okay, we have X amount of ventilators in our system, we don't have that information yet. We are trying to continue to gather that, working with the hospitals, working with available resources we have, and if we need those ventilators, then we'll have them.
Understood. I think what would be good to know, or you said if we have a surge, we're able to handle that. And that's critical to know, right?
Yes,
that's
ma'am.
extremely reassuring. I guess I'm asking, okay, how do we know that was really my question, right? How many numbers, this or that? That's what I want to know, is you're telling me if we have a surge, we have enough for everyone.
If we have a surge, we have plans to where we could build out the fairgrounds. We could move into the Freeman Coliseum. We could move into the AT&T Center. We have planned out to that magnitude.
Okay, great. That's like thousands and thousands.
Again, but we have plans, but we don't want to strike fear in the public. We want the public to understand that we have planned and we have contingency plans. But again, we have a large footprint to work with, and we have people right now at this very moment that are working on the resources to support those locations if we have to.
That's very good to know. Thank you very much, Chief, for going into that. And then a couple other things. Dr. Emmerich, I know isn't here, but mentioned something about reaching out to a comprehensive plan with physicians. So I just wanted to make sure we coordinated with her. My office had, so I don't know who's representing her. Dr. Bridget, my office had some calls from primary care physicians who were really interested in learning a little bit more. And so I just wanted to make sure we coordinated with Dr. Emmerich to ensure we could support with this, what we are calling a hotline for physicians if they do have questions. So just certainly don't want us to be working at cross purposes. So I'd love to make sure I can coordinate with her on that.
Okay.
Thanks. And then lastly, I want to give a thank you to Ray Chavez and the San Antonio Manufacturers Association. My office reached out to them regarding manufacturing of, basically what we have shortages of, and he gave us a brief overview. Basically, as requests are coming in for additional equipment that's needed, he's sending them out to his members, and at the moment it looks like there's some work being done on cloth covers for N95 masks to extend their lifetime. Some face shields would be produced in the near term, production of parts of ventilators and sanitization equipment. So I want to thank the manufacturers who are stepping up at this time. So thank you very much.